Greetings and welcome to Alumni Day. I want to thank the Stanford Medicine Alumni Association, whose ingenuity and hard work have made this virtual program possible. Though I miss meeting in person with alumni and helping celebrate with the reunion classes, I am most appreciative of this opportunity. I'm delighted to share with you how Stanford Medicine responded to the pandemic, the lessons learned, and the insights we've gleaned about the shape of this new normal. So much has changed at Stanford and around the world since we last convened in 2019. I will always remember the early days of COVID-19 when I learned one of our faculty had contracted this disease. As the virus spread around the globe, Stanford Medicine proactively prepared to handle the worst. Yet when I learned that one of our faculty members was ill and had become sick with COVID-19, the gravity of the situation hit me personally. In the ensuing weeks and months, I was astounded by the first responders and researchers on our campus and abroad. With no clear guidelines for fighting this disease, clinicians identified how to provide care to patients in critical need. Simultaneously, researchers rapidly and creatively adjusted their work to address the pandemic. Their discoveries have proven critical to our pandemic response. I hope you're proud of your Stanford Medicine community. In the face of enormous challenges, we met the moment across our tripartite mission. I'd like to share with you some examples of our notable firsts, nimble pivots, unwavering resilience, and vision for the future. Long before the World Health Organization declared the novel coronavirus outbreak a pandemic in March, a number of innovative and dedicated Stanford researchers were already responding to the threat of this virus. Shortly after the first case was announced at the end of January in 2020, Dr. Benjamin Pinsky at Stanford's Clinical Virology Lab began developing a diagnostic test for the SARS-CoV-2 virus. He spent February refining and evaluating it. Remarkably and fortuitously, Stanford Medicine announced it was one of the first to have developed a diagnostic test. Having such a test and the capacity to process the samples quickly was extremely important for Stanford and the Bay Area. Very rapidly, we were handling hundreds of samples from hospitals around the region. Those tests enabled us to provide public health officials with critical information needed to inform decisions as they worked to contain the infection. Another group that showed great foresight were our hospital administrators. Early in 2020, they started to shore up access to ventilators, N95 masks, face shields, gowns, and other vital PPE. The new Stanford Hospital immediately proved its value, and we quickly refurbished 2 units in the original hospital to handle overflow cases. A key concern for us was the continuity of care for our patients who depend upon us for their care. We developed safety protocols to allow patients managing chronic diseases to receive the care they needed and ensured that patients enrolled in crucial clinical trials could continue to participate. And when the state ordered hospitals to suspend non-emergency procedures in the spring of last year, we began leveraging telehealth to continue the care we deliver. We set up drive-through COVID-19 testing facilities, which also accepted walk-ups and bicyclists, around our region. And we also launched our Crown Clinic to treat COVID-19 patients who did not need hospitalization. I'm proud that our community and others around the state looked to us for support as they navigated the pandemic. For example, Stanford Medicine provided highly valued modeling and statistical advice to school districts in the Bay Area and Los Angeles about testing as they considered how to safely resume in-class instruction. In December, even as we were dealing with the post-Thanksgiving surge in new cases and hospitalizations, we began vaccinating our frontline workers. At this time, the Pfizer and Moderna vaccines had just recently received emergency use authorization. By mid-January, we had offered a first dose to all of our healthcare workers. We were proud to complete second doses about a month later, ensuring the safety of those providing healthcare in the Stanford Medicine community. Since then, we've begun vaccinating eligible members of the Bay Area community. We now have 8 vaccination sites around the Bay Area, including the latest in East San Jose, an area that's had one of the highest caseloads in the country. All told, if we have the vaccine supply, we're able to vaccinate up to 10,000 people each day. Even as COVID-19 swept the nation and forced us to stay socially distant, other diseases refused to shelter in place. In the face of this challenge, Stanford Medicine rapidly created innovative, safe solutions to ensure that those affected by something other than COVID-19 could receive the care they needed. An essential tool in this effort was telehealth. We developed telehealth capabilities years ago, but they remained a tiny percentage of our services. Before COVID-19 hit, we had just a handful of telehealth appointments each day. For example, Stanford Children's Health averaged 35 per day before the pandemic. A month later, after shelter in place, that number increased to 800. We saw a 50-fold increase on the adult side, as many as 3,000 telehealth visits per day, a swing from about 4% to 70%. It's now leveled off at approximately 40% of outpatient visits being done by telehealth. Moving forward, it's vital that we develop and utilize telehealth wisely. This includes maintaining strong physician-patient relationships. It also requires striking the right balance and better understanding which patients see the most benefits from telehealth and which could have better outcomes from in-person visits. By and large, patients have provided overwhelmingly positive feedback about everything from the quality of care to the conveniences of at-home care. We're excited about the potential of telehealth and believe we're only scratching the surface. For example, with the right technology, it's possible to take blood pressure readings and monitor glucose levels via telehealth. I have no doubt that as the practice becomes more established, it will drive the development of even more technologies, expanding our ability to provide preeminent care. Dozens of scientists quickly pivoted to address COVID-19. Our researchers studied various aspects of the virus, how it spreads, treatment options, and other impacts of the pandemic. For example, Dr. Scott Boyd led a team that rapidly developed a test to detect antibodies in blood samples, a critical need as we tried to track the spread of the disease in the population and better understand how the body's immune system responds to the virus. Doctors Michael Snyder and Megan Mahoney and their teams studied whether the biological data available from wearables, specifically heart rate, could detect infection earlier. The answer was a resounding yes. They moved to phase 2 in December after finding that their algorithm could detect COVID-19 illness a median of 4 days before the onset of symptoms. Dr. Andra Blumkallens, our Chief of Emergency Medicine, is a principal investigator at Stanford for a multi-site phase 2 clinical trial to test antibodies designed to block the coronavirus from infecting human cells. Even as millions are vaccinated each day, thousands of others are newly infected, and therapies to lessen the severity of disease are still vitally needed. Dr. Blumkallens and her team are investigating the efficacy of monoclonal antibody therapy for COVID-19. The hypothesis is that these therapies will reduce early symptoms of COVID-19 in people with mild to moderate cases of the disease. I would be remiss if I didn't also mention the transformative work of Dr. Bonnie Maldonado, who spearheaded Stanford Medicine's pandemic response and advised numerous government bodies. If that weren't enough, she's also involved in many research projects related to COVID-19. While recognizing the extraordinary efforts of these 5 individuals, so many at Stanford Medicine made similarly impactful contributions to our pandemic response. I'm grateful to all of them. In addition to individuals and labs, we also saw an entire program pivot, Stanford's Innovative Medicines Accelerator, or IMA. Too often, a promising idea in the lab never reaches human tests, a chasm that researchers call the Valley of Death. In 2019, Stanford launched the IMA to bridge that gap. By leveraging the strength of Stanford Medicine's biomedical ecosystem in collaboration with the rest of the university, the IMA enables faculty to generate and test novel medicines. It brings together the deep expertise found in our School of Medicine and the interdisciplinary life sciences institutes such as Stanford ChemH, Stanford BioX, and the Wu-Tsai Neurosciences Institute. We developed the IMA because of its immense potential, but we had no idea that an urgent health crisis would elucidate the need for such a program. When the pandemic hit, Stanford focused the IMA's resources entirely on fighting COVID-19. As a part of its efforts to slow the spread of COVID-19 as quickly as possible, the IMA provides funding and expertise to assist with collecting and storing tissues. This approach allows us to conduct the studies needed to better understand the disease and, in so doing, to improve our ability to prevent and treat it. The IMA also is utilizing organoids. These mini organs, including brain, lung, and intestinal tissue, are created in lab dishes and allow researchers to test ideas in cells representing actual human biology. One more critical area that the IMA helped to fill: safe lab space. We realized quickly that we would need more space for the number of researchers working on virus-related work. Because it's highly contagious and airborne, work on the novel coronavirus requires a Biosafety Level 3 or BSL-3 containment facility. In April of last year, the IMA began expanding the existing space we had in the Keck Science Building, and it was up and running by the fall. These efforts by the IMA will not only save time, possibly the most vital resource we have in the middle of a pandemic, but they also promise to provide insights into a range of diseases in need of new medicines and even help us prepare for a future pandemic. The pandemic has underscored the importance of the social, behavioral, and environmental determinants of health. 3/5 of California's COVID-19 cases and nearly 50% of the deaths have occurred in people in the Latinx community, despite the Latinx community comprising less than 40% of the state's population. You can see a similar disparity in our Black community. Though African Americans make up approximately 4% of the state's COVID-19 cases, they account for 7.5% of the deaths from COVID-19. This disturbing trend mirrors data from other states across our country. A CDC report released last October showed that Latinx and Black Americans died at disproportionately high rates compared to the general population from May to August. Deaths among the Latinx community rose 10% over those 4 months, the largest increase of any group. These stark differences go beyond genetics and social determinants of health, and they certainly extend beyond COVID-19. In many cases, these social determinants have another name: systemic racism. Consider Washington, D.C. The difference in life expectancy between our national capital's longest-lived zip code and its shortest is a staggering 32.9 years. Yet the physical distance between these neighborhoods is less than 10 miles. This disparity shows how our environment profoundly shapes our health. This includes the air we breathe, the food we eat, the services we access, and the opportunities afforded to us. Stanford Medicine has long endeavored to address this essential part of health, and the pandemic has fully exposed the significance of this challenge. After the murder of George Floyd in May of last year, I met with David Entwistle, CEO of Stanford Healthcare, and Paul King, CEO of Stanford Children's Health. We realized that we needed to take a more direct approach to inequality. We agreed on a two-part approach. One, how can we strengthen and improve our own culture here at Stanford Medicine? And two, how can we, as a preeminent academic medical center, bring about change around the nation? We recruited and launched the Stanford Medicine Commission on Justice and Equity last year with that two-part mission. The commission is chaired by Rosalind Hudnell, former Vice President for Global Corporate Affairs at Intel and President of the Intel Foundation, and is comprised of national experts, advocates, and leaders on social justice and equity from inside and outside of Stanford. After meeting with numerous groups and individuals at Stanford, the Commission will make its recommendations for how we can bring about change within our campus and more broadly. Their work will build on the important achievements of a number of groups within Stanford Medicine, including the Diversity Cabinet, which includes representatives from a robust mix of faculty, staff, and student organizations. Stanford is committed to fighting racism, promoting inclusion, and erasing these unconscionable health disparities. We're increasing the diversity of our MD and PhD classes. The incoming class of 2020 is among the most diverse in our history, and the trend line is going in the right direction. Increasing diversity in biomedical research labs, physicians' offices, and hospital rooms is not just the right thing to do. It's also smart science. We find time and again that diverse interdisciplinary teams create the fission and bring together the right mix of expertise and insight to answer today's research questions. While encouraged by all that Stanford Medicine has accomplished to address the pandemic and issues like systemic racism that the pandemic has laid bare, I recognize that the work ahead will require a sustained and concerted effort by all of us. The goal is a society where physicians have more impact on health outcomes than patients' zip codes, where prevention and prediction are the central tenets of our healthcare system, and where we cure diseases precisely. Stanford Medicine continues to rise to meet the challenges of the COVID-19 pandemic. With each vaccine dose administered and every precaution we take, we get closer to the end. I am proud of how we responded, and you should be too. In this crisis, your alma mater has made a difference in our community and beyond. With perseverance and resilience, we will hopefully be meeting in person next year. I certainly miss interacting with you in person and hearing stories at reunion class events. I want to thank again the Stanford Medicine Alumni Association for their hard work in producing this virtual event. Thank you very much, and farewell.